I've been interviewing people for 23 years. I'm so young. But nafe-feel ko talaga, Abet, yung care mo. Kasi empathy became like a marketing byword eh. But it's different when you're speaking with someone and they genuinely empathize, alam mo yon, with the people who really feel the impact of the business, in this case, the patients and their families. So, my next question, you said you're testing na, di ba? You have some home care clients, especially during COVID. What has servicing them taught you that has also helped you become a better business owner?
What our home patients have taught us is it's different from a hospital setup. It's very different. It's not the same thing. So the way we handle home patients has a different um, touch compared to the hospital. Not that it's good or bad or anything. They're just different.
Mm,
Um, the You don't just talk to the patient; you have to talk to the family.
mhm,
It's about supporting the family and what to expect. Expectations need to be aligned, clear. Honesty is important.
mhm,
Setting expectations is important. And then I think on the patient care aspect, empathy is important. So there are, again, these are not bad or good things. In caring for humans, what I've learned is there are different ways to care. There's just not one way.
mhm,
And it doesn't make one way of caring bad. So we shouldn't judge that because there are different kind of healthcare professionals, different ways of approaching, and a lot of them are correct.
mhm,
But you just need to find what works for you. So, for example, in caring for a sick patient, a lot of depending on the age, also that's a big factor. Are you taking care of an older person who's active, like who can speak, or a palliative care person who can't speak, right? Or are you taking care of a child?
mhm,
There are children on ventilators, actually.
mhm,
There are children on ventilators who are mobile, who are not mobile.
mhm,
So the way you handle, you have to get to know your patient, and that's very important. So that's how empathy is.
mhm,
It's understanding where the person's coming from, where the other human's coming from, and adjusting your care and knowledge towards that person. It's not about being nice, it's about
mhm,
being professional. And professional for me and for Equilife is doing your job still because you're a medical professional, for example. You
mhm,
have to do your job. You have to tell them what the repercussions are of their decision. You have to tell them their options.
mhm,
But you do it in a sense where they're involved because that's not our life, that's their life. They need to make the decision. Our job is to only show the options and do the do the do the work for them, right?
mhm,
But it's their choice at the end of the day. So for me, healthcare empathy is related to that.
mhm,
That's how we learn to take care of home patients and also
mhm,
patients in the hospital. I mean, families because they visit the family member who's sick. So we've also
mhm.
dealt with those are the things we learned from dealing with direct to patient situations.
Okay, thank you for sharing that. Tama. It must take a lot from you and your team. And so, I mean, props to you guys kasi I'm sure, di ba, parang you stay professional, but as humans, you also might get affected, might, by the patients that you service and their families. So, kudos talaga. Ano yan eh, it takes a lot out of the professionals who provide the service.
Yeah.
Let's zone in on the technologies, Abet, and the machines that you offer. No? So, what sets Equity apart when new potential clients look at you versus competitors? Why is Equilife worth the investment?
Sure. I'll answer that in two parts. The technologies and the machines we offer are tested. their quality. The biggest explanation I have for this to hospitals and anybody who'd ask me why our equipment or why we chose that equipment or why our price is the way we are. Now let's talk as a business. Equilife owns its own equipment. We own fleets, thousands of equipment, right? Fleets of equipment.
Mm.
So you can think about it from our perspective. Do you think we would buy cheap breakable equipment if we
Mm.
had to own everything, right? We wouldn't, because it's a
Mm.
headache, it will break, and as a business, we will lose money.
Mm.
So now, as a client, you can see that it's not to our benefit to buy cheap, breakable, untested, low
Mm.
quality equipment para lang makatipid. So, in that scenario, that first scenario, our incentives are aligned. You
Mm.
know, as a company, we're not going to try to cheat you on equipment to get you the cheapest one,
Mm.
right? So I think for me, because I'm quite pragmatic as a person, I'm not ashamed to say that, because that shows the client we're aligned in our incentives. You know, we will choose quality equipment.
Mm.
So that's one. And for the technology aspect, we work with um, American, German, Australian companies. Of course, China and Taiwan is also there. Um, but for the other Western countries, these are companies that have built these equipment, tested it in the biggest, most famous training hospitals like in the West. And those are the equipment we bring in. So all of our ventilators are actually American, German, Australian, um, Swiss,
Mm.
uh, because they're tried and tested. They've been
Mm.
running for many years. I mean, they've been designing and redesigning them for many
Mm.
years, and it's not conking out. It's been stable. Its technology is trusted, and reliability is very important to us. So that's one. And then technology wise, because we are always looking to these manufacturers, we get a head start in testing a lot of devices. So one of our
Mm.
newer devices, I think this is the one you saw in the hotel recently in the event. It is a ventilator. So normally ventilators, they, if you're familiar, they put a tube down your breathing line, right? So
Mm.
um, a lot of the newer devices are starting to build stronger non-invasive breathing equipment. So of course
Mm.
there's non-invasive equipment since quite a long time, but the newer technology is even less invasive, meaning if before they would put a tube down you or even make a hole here,
Mm.
the newer technology, as it evolves every year, which is really great, I'm very excited about it, is they use cannulas, like just that oxygen cannula.
Mm. Mm.
So the thing with ventilators, right? They force the air down your throat, right?
Mm.
Now the newer technology tries to remove that.
Ito na lang. Yeah.
It's just a cannula, but it's strong enough to still
Mm.
push that breathing, that air into you. So
Mm.
imagine, by doing that, you're less prone to infections,
Correct.
irritations, because it's not invasive, it's not inside you. And
Mm.
as a person, mentally and physically, you're more comfortable as a patient.
Mm.
The nicest thing I've seen is there are non-invasive that you wear a mask, right? And sometimes it's very painful in your face. I mean, I've seen people with sensitive skin. Sometimes it's thin because they're quite old, and then this mask is really pushing into their face, and it's very painful.
It's
Also,
12 o'clock.
Mm.
and so now these people are trying this cannula type, but still pushing the air. It's a new kind of device. It's called a precision flow. Um, and they're eating. They can eat. They can talk.
Mm-mm.
So the for me, the comfort of the patient is changing. Imagine that was your parent, uncle, aunt, and they're in less pain,
Yeah.
right? And that's the kind of thing we're also very excited about in terms of technology. Back to the Filipinos deserve better.
Yeah.
Um, these are the technology that if it's available, just make it available here. So these are
Right.
the things we're offering now. So like a lot of our hospital clients are carrying this. They're using
Mm.
this for some of their patients. Their baby patients, their
Right.
neonatal patients are using it as well. Imagine a small baby that sometimes they need to use the tube. Sometimes they have to use a mask. But now the baby is just using a cannula,
Yeah.
right? And as the years go by, technology evolves. So that's something we're excited about as well. So yeah, that's what type of machines we're selling and we're renting. And we're very excited about that. And what sets us apart, why we're worth the investment, I think it's the service behind all of this, definitely. I talked about it a while ago. It's so different when you're not dealing with people who are just dumping a device on your in your house or in your hospital. You're talking to people who has the operating side and who has the management side,
Mm.
right?
Yeah.
So I think when you deal with Equilife, you're not just guaranteed quality equipment, high tech equipment. You're also guaranteed that if it conks out, there's a replacement. That's number one. Like for me, if I bring a patient at home and I have
Mm.
a machine and it conks out, the last thing I want to do is bring my patient back to the hospital and call an ambulance.
Mm.
That's the worst. So, and I talked to my team, this happens. I mean, not with us, but with other providers. They
Mm.
wanted the cheapest equipment. They call at the middle of the night, walang kapalit.
Mm.
Happens, patient cannot breathe, goes into distress. They call an ambulance, they go back to the hospital. Diba? That's
It's
why
really
nga you went
cool.
home, so
Yeah.
that you did that. So
Yeah.
that's where that service aspect comes in. May matatawagan ka ba sa gabi? May kapalit ba yan? Things happen eh. That's the thing. Let's not underestimate. Healthcare is not 100% thing. Things will always happen. So it's about
Yeah.
getting security and mitigating risks. And I
Yeah.
think that's where Equilife is very good at. We're not an equipment company.
Yeah.
We're actually a service company who happens to own a lot of equipment.
Yeah. Thank you, Abet. And I guess, di ba, parang going to my next question. If I'm a homeowner with a sick loved one and I have no idea about these machines, I can trust that Equilife will be number one with me 24/7 anytime because life is unpredictable, life is imperfect, and you're there when I need you. At the same time, you're gonna teach me yung integrity ba, yung what you mentioned earlier, no? Yung what I need to understand about the machine. So if I'm a carer, I wouldn't have to feel insecure because you're also going to educate me about the machines that we're gonna have at home. Okay. Um, okay, just to ano, for those who are for the home care, home service and home care patients, and yung mga looking into ito na, they're looking for machines that they can rent for their sick loved ones at home. What would you recommend and why?
Well, it would highly depend on where the patient is at, right? A lot again, I was saying a lot of equipment what is not for everybody. So it depends what size you are also, like what age, what size, what um sickness you have, what's your setup. So again, because it's very niche, um I think what's important is number one, work with a company that is has hospital grade service. And I think that's what made it easier for us to transition to helping people go home because we're used to taking care of hospital service. The equipment you're using, some of them are very similar to the hospital. So you're not getting something lesser. So I think that's what's very important, right? Um, and you'll usually know what equipment you need while you're in the hospital because something's happening to you already. As a matter of fact, you may have used in one way or another that same equipment, but it's for the hospital. So the next question is, what can you bring home that's similar to that or the same if it's possible? There are ones that are possible that can be set up at home. There are home versions of the hospital equipment you're using, but all of that
Okay.
will be explained. As a matter of fact, my team, when a patient is transitioning at home, they go to you in the hospital palang.
Mm,
You even sometime, more often than not, you test the equipment in the hospital palang.
mm,
So you're not surprised when you get home. So let's say you're transitioning home, your doctor gave you a go ahead, which is good. It means your patient is stable. We'll start testing with your so that your doctor can see because the doctor won't give you a green light
mm,
if you're not stable, right? So that kind of assurance and quality is already there. That's how you can choose. Number one, get a provider, and this is what Equilife does, who has a lot of equipment because these are equipment. So you don't want to
mm,
be stuck with one. Tapos pag nasira, wala kang choice.
mm,
Get a provider who has worked in a hospital setting
mm,
so that they know the quality of care required.
mm.
And then get somebody you can call at the middle of the night, right?
Yeah,
So that you don't have to run back to the hospital if it can be avoided.
right. I love that you said it's hospital grade service, no? For just in case there are people, Abet, who are still skeptical na parang, home care, same quality ba yan? Well, we're answering you now. Yes, more or less. Hindi nyo lang siguro may uuwi ang surgeon ninyo, no, or yung doctor ninyo. Pero in terms of yung care with the Equilife team, and then yun nga, anytime something happens, you can call them. You can be, you can rest assured that you will get the best quality of care. So, syempre, Abet, when we talk about health and wellness, it is an economic concern, right? In a country like the Philippines. That's why there are many different kinds of HMOs and health and life insurances, and many Filipinos who do not have them. But that would be a topic for a different discussion. So, those who are tuned in, we hope that you've gotten to this point. Again, please visit equilifemedical.com if you have a patient or you're in the hospital now and you want to bring your patient home, but you want to continue the quality of care that you're receiving in the hospital. Go to equilifemedical.com and send your inquiry. They'll get back to you. So, Abet, those who are tuned in up until this point, so we're probably gonna cut this episode into two so people can listen to our discussion in 30-minute intervals, no, in snippets. They're probably wondering how affordable you are, especially for home care. No, kasi etos naisip ko naman, baka naman may payment terms. No? So please address this part. How affordable is Equilife? Or, for people who can't afford the isang bagsak payment, how are you able to accommodate them?
Yes, that's a great question. And it's something I can empathize with in terms of and resonate with in terms of having different financial or financing options for access to healthcare. Definitely, our HMO system, our insurance system actually needs a lot of work and it's still at its nascent stage, right? We still pay for things a lot in cash,
Hmm.
especially if when it comes to healthcare, right? Because our insurance system is not as mature, and even the mature ones are starting to have problems in other countries. So it's a big challenge, but I believe it will be solved in our lifetime. I want to be hopeful, um, but definitely Equilife has financing options. So we work with some banks and with some companies to help you finance it at very affordable rates. That's one. We are already talking. So at the moment, it's not covered by insurance, but we are working with different kinds of insurances to figure out how to get this service covered. Home care, critical care at home, or life support at home is generally not covered. Generally, is the keyword. But there are insurances that are starting to cover it. So it really depends with your insurer in particular, right? So I think that's something we're trying to figure out with them. So because it's not available yet, to be frank, we have financing options, and then we have different types of equipment available. What we did is a tiered system where there are different kinds of equipment you can choose from, and then we'll explain to you the differences. All will probably likely do and supposed to do the minimum required output you need, but the
Right.
more the more modes you have, it could be more expensive, of course. But I think what we wanted to make sure in Equilife is that you have an option.
Right.
So we don't just force feed you the most expensive machine. If I
Right.
know you don't need it, then I won't bring it up unless you want to know about. I mean, I'll tell you about it, but I'll tell you about another option.
Mm-mm.
And that's actually what has evolved in Equilife over the years, that we don't stick to one type of equipment, because when we started to get to know the system, there was this problem of financing,
Mm-mm.
not just with the home care patients, in the hospitals rin.
Mm-mm.
In hospitals you have different types as well, right? So that you're not forced to get a suite room,
Mm-mm.
right? You can get a ward.
Yeah.
So that's kind of how we tiered our model as well, so that people have options. And then there's financing.
Wow, thank you for that, Abet. So kung nakikinig po kayo, whether hospital po kayo or pamilya na may pasyente, sa Equilife po may options. Huwag po kayo mag-self-reject. Kasi madaming Pinoy ang ganyan eh. Hindi na
Wag
lang
na
sila
lang.
lalapit. Oo, huwag na lang, nakakahiya. Huwag po kayo mahiya, please, kasi we're talking about the health and wellness of your loved one and your family. Okay? So please just message Equilife on Facebook and go to their website. To close our podcast, Abet, it's when I learned so much about medical equipment and about Equilife. Thank you. My original question was what sets you apart, which you actually already answered kanina, no? When I asked why you are worth the investment. So forgive me, Abet, I'm gonna ask a question I wasn't able to give you prior, but it's fairly easy. Hospitals and patients who are not yet with Equilife, not yet working with Equilife, but now after getting to this point of the podcast, they're considering reaching out, no? What is your message to them? Yung mga hindi nyo pa customer.
Get in touch with us. That's number one. If you're not working with us yet, we'd love to be able to help you, and let us know how we can help you best. And we'll walk through it with you, right? Um, my message for them is there's always usually a way to get things done. I think we're all in healthcare, for hospital people, for hospitals. We're all in this together. We're not just a supplier. We're actually going through the motions with you. We're on the same boat. We wanna Our business and our value proposition is not to just put equipment in your hospital. It's to help take care of your patient. And because we're on that same side and on that same boat, we can build things together. We can figure out problems together. And for patients, there is always a solution. I'm sorry it's taking so long for healthcare to be solved. I'm very frustrated too, but as a user of healthcare too, personally, there is a solution out there, right? There are people who actually care, medical professionals care, hospitals care. I know we all have our own experiences, but the healthcare system, we're all a group. We're all hospitals, providers, nurses, allied professionals, non-medical professionals in healthcare, governments, patients. We're all trying to make this work. So when you find a good partner, provider, let's improve it together. Give proper feedback, right? So that we get better, you get better, everyone gets better because we're dealing with lives. So we have to make the system work, and all of us are part of that system. So that's my message to patients, and other hospitals. Right, we're a system, and as long as we're all committed to making it work, such as Equilife, who's always committed. It's not, again, we're not an equipment company; we're a service company.
Mhm.
So who happen to have a lot of equipment, right? So let's make the system work together and come up with more innovative ways to get these things to our patient, to get the service, to get the therapy, to get the machine, to get the surgery out to our
Mhm.
patients. And hopefully those patients experience good care so that tumulong rin sila sa healthcare in the future, di ba?
Mhm.
Parang self-fulfilling prophecy yan eh. That's what I personally believe. It's a self, it's gonna solve itself if we're all helping the system and feeding the system together. But it's not just Equilife's job. It's not just the
Right.
hospital's job. It's also the patient's job,
Yeah.
right? We all have a role.
Yeah.
When it comes to these kinds of industries, it's really a team play.
Mhm. Okay. Thank you, Abet. It's been a wonderful morning spent with you. Thank you. I feel like, listening to you, I was reminded of the core values then of Tayo Health: empathy to the patient, integrity when it comes to medical information, and of course, yung service. And alam mo, I'm sure yung mga nakikinig na pasyente, naramdaman nyo na ba yung pag nagpunta kayo sa ospital o may tinawagan kayong clinic o professional, and naramdaman ninyo na para lang kayong negosyo? No? Yung parang source lang kayo ng negosyo nila. Pero sa Equilife Medical, from what Abet has shared with us in the past hour or in the past 30 minutes, for those who are listening to either part one or two of this podcast, is that they really care and they mean what they say. This is a team that really cares about you from hospital to home. They don't stop. And not within office hours too. It's really 24/7. So, thank you again, Abet, and to the rest of your Equilife Medical team. Marami pong salamat sa inyo. Maligayang Pasko. And as Tayo Health, we want to see a bigger, better year for Equilife because that means you're helping more institutions and more people. So until our next podcast, this has been Magsanoc of Tayo Health. Take care and be well.
Thank you, Kai. Take care.
Thank you.